2026, April 5th, Sunday, 10:30 in the morning. It is 83 degrees. Update of my recovery, ACL and meniscus surgery. Right now I am on week 6 post-surgery. I was cleared with no restriction couple days ago. 3 days ago. Now I can step on the ground and walk, and no restrictions on my bending as well. Right now I am still on crutches. I am trying to get used to it, to walk with 2 legs. And then hopefully in a week or 2 I can slowly not using the crutches. I went to the physical therapy the day after my appointment, and my physical therapist did not aware that I had an appointment yesterday. So she found out right there. Then we can start bending it past 90 degrees. The goal I have is to reach 120 degrees by next month. My next appointment on May 5th. So there will be 30 degrees more than I need to work on, from 90 to 120. And at my physical therapy appointment, I was able to reach 100 with a lot of screaming. So I think we are getting there, little by little. But very painful, very much so. My 1 month follow-up visit with my surgeon. Again, I was right. He was only there for maybe 5 minutes. Just tell me, oh, okay, keep working on it. You have to reach 120. If not, we'll have to do a surgery again to clear out those scar tissues. That just doesn't sound very fun. Okay, and there are 2 exercises you can do, this and that. Okay, goodbye. I just don't understand. You really in a rush, huh, doctor? There's no emotional support or anything. Hi. This and this. You need to be able to do this. Okay, bye. Don't know, it kind of bothers me. I'm not sure if it's a lot of doctors are like this way. Personally, little more time with me I would appreciate that. A little more emotional support. Personally. And I go to my physical therapy at the same practice. And the same way, the PT, we can short it as PT for physical therapy. They are the same way like my surgeon. My PT is watching multiple patients at a time. Or spend 3 minutes with me and then go there for another who knows how long, 10 minutes, and come back and see me again. So I'm not sure. I've never been to physical therapy before. So I'm not sure if it's normal this way or just this one I go to is this way. Just so busy. I also want to mention that I realized I have been posting this podcast for more than 6 months, and I do it every week. So I think this is a little something to me that I initially doing this for just a place that I can, like a journal, to have a place to keep, to have a record of myself, my journey, my anything. I wanted to talk about basketball. That's something I do for fun, and talk about something spiritual that I spend quite of my time for and suddenly this turned into acl+meniscus channel. I definitely did not plan for this, but this is where I am right now. I only mentioned this podcast to one person, and I don't know if there's anyone is listening, or and I don't know, I don't know how to see the numbers, the who is listening, or how many people have listened. I don't know. I didn't know. I don't know how to check, how to see. Maybe later I'll try to get into that. But right now, I don't know. And because of my injury, I've learned something new, such as ACL, meniscus, the rehab, prehab, physical therapy is called PT, physical therapists, PT, DPT, they are also doctor, and they are PTA, physical therapy assistant. Also PA, physician assistant, that I see PA when my surgeon is busy. And week 6, still out of work. And I plan on taking another month just to hopefully by that time I can walk better, and then just in general a lot better. That's I'm hoping. And this can be very lonely, this recovery, no matter if there are people side by side there for you, or they say they are there for you, or there are no one there for you, or there are people that think you should do better, you should do more, because you are using your injury as an excuse of not doing something. This journey is lonely and incredibly hard. It's draining your everything in you is draining out. You don't have friends. No one is checking on you or me. And I don't want to reach out as either. I feel like I'm done reaching out. That means I'm just not as important. If no one is reaching out to me, that means I'm not that important to those people, right? That I think that I would right. So maybe there's something I'm hoping to have is the someone, a relationship that your body, that someone is willing to die for you, to do anything for you. Because not always, a lot of times I would hear from different people say, oh, that's my best buddy. We do this, we do that. And I think to myself, that's nice. I don't have that buddy that we can do this and we can do that. I have no one. There's no one that is close enough, in terms of distance wise, because if it's someone if you're friends with but they live half an hour away, that's different. You can't just drive half an hour away or longer to hang out, right? Everyone is so busy. And Some people I know, they are not half an hour away, they are oceans away. So there's something I would like to experience, to have a body there. I guess I never just got a chance to have a body in my life so far. So maybe one day. Maybe one day. And as for now, I will still keep uploading every week. That is still the plan. No matter if it's just 3 minutes or it's 45 minutes, I would like to keep it consistent. And who knows? Who knows what this will take me? And I think I'm getting to a point in my life that I don't know. Sometimes you just want to bang your head to a wall. Bang it really hard. And say, why? But sometimes you think to myself, just one day at a time. Just be glad you wake up every day. Okay, today I wake up. I woke up. Another day. Another beautiful day. Or whatever day it is. Another painful day. Whatever day. I wake up. And this is what I'm going to do. Is to make good use of this whatever day it is. And try to make every single decisions as good as you can. Oh, I'll say, maybe I shouldn't say that. I should say something better. Let's take a break before I say this thing. Even though I think I'm right. I have all the reason to say that. But let's think about it. Let's calm down a little bit. Let's take a few seconds. Before I mess it up. I don't know. But this is where I am right now. At least. Big day coming up next month. It's going to be a big milestone for me. Just a year that hits differently. A big milestone. 2026. 2026 is hitting me differently right now. That's what I can say. Side notes. I don't like the tap tap. Tap tap. Tap tap on the can of Coke. Tap tap something something. If you know, you know. The picture of the week is me doing my rehab exercise at home, laying on the bed, facing down, legs out hanging, let the gravity do the work, let it hang, let my knee, try to get my knee straight. Very uncomfortable. In many ways. Alright, April 4th. Today is Easter, I think. I don't know what Easter is. Did not grow up celebrating Easter, so I don't know. That is something, not something I do. And I was thinking about something. What if I paint my whole house a same color? Might look cool. Anyway, that's it for this week. Take care.